another video in the series of medical care on the road, living out of your car, even if you're out of your tent or however, and how you still need to maintain levels of hygiene and safety, especially when you're doing injective therapy of any sorts. And it's easy to get lax in these circumstances, especially as you're tired and you're not feeling well. If you cut corners when it comes to medical care, I mean, we see it in overworked nurses and doctors where they forget to wash their hands, and it literally is life or death for their patients when they pass on C. difficile or some other resistant infection. Well, when you're working with yourself and you're your own nurse or doctor, you got to be really careful. So again, it's about 73 degrees today. I'm in the car, I have the windows down or up pretty much to prevent the noise here. So I am dressed in pants from below, but I'm shirtless because I just did some of my vitamin D therapy, and I apologize if those who it offends, but I'm just gonna be me on here. And I just got a good sink shower, which I did a little documentation of the bathroom I use often, so you can kind of see what things look like. It was nice. There's not a lot of people here today for some reason. And I want to go through the specifics of some of what I do and how I manage it here from my cockpit, I should say. And I'll find a way to get the steering wheel out of the periphery, but for now, bear with me on everything. So I have a little compartment right here in my front dash, and I'm going to try to show you some of this. So also we'll show you, well, over there it looks a little cluttered because I have my CPAP mask and stuff, and I'll get some UV on it and I'll clean that out and use the sun on the dashboard. I got my little support crew. The dinosaur is, he has a little more trouble standing. Well, we're gonna keep him down, but we got our crew here. We got our hearts surrounding us. It helps. Ganesh. I was telling you the other day, I put little stickers, other little things, reminders. Here's the little compartment that I have, and I use this. And what I do to help my brain remember how many injections and where I'm at, you can put this in your phone, your calendar, but I get 5 syringes because I have to do 5 injections. And today's day 1. So I'll put all 5 and I'll take 1 out. And then that's when I know if I run out, I know that I'm over, my week's over. I also put these, which you can buy at any store or whatever by order, a large pack usually at the beginning of the year on Amazon. And they're just sterile alcohol prep pads. Take 2 out. All right, back to this. Apologize for hopefully I'm not getting anyone nauseous. And then here on my door, I get these for about $1. And I try to get the non-scented hand sanities, but these in blue I like them. I hang them. I have one hanging on my backpack. And I try to make it as accessible as possible because hand washing is the best way to guard us from infection and flus and colds, but also anything when we're doing injective therapy. So I make sure I do that, especially after I just touch my phone. So I'll add a little bit more. I also have sanitizing wipes that are tea tree based and help do a cleanup, but I try to go with the old alcohol because it should kill off most things. And yeah, that's how I get started. So the first thing I do, and I'm not going to show the full injection because I think we've done enough videos on that, but maybe down the line they'll be more related. And I'm going to do a full-on peptide related video to talk about that treatment and what I'm doing. So I take the first swab and I clean off the area on my lower abdomen, and that's where I clean it. Always, even no matter how clean I think I am, always comes off pretty dirty looking. So I do that. And the second one is for after. Once I've injected the fluid into my belly, I rub it vigorously with the second pad. So all in all, each injection at the end of the day must cost me, well, besides the medicine, if you buy these in bulk, they're not expensive. I'd say pennies, maybe maybe 10, I don't know if they're like 10 cents a piece. I'll find out the per unit cost. Eventually I'll be breaking down a lot of this stuff. And then on ice, I have to be really careful because this medicine's expensive and I don't want it to ruin the efficacy. I have my vials of the 2 peptides that I'm currently utilizing for my treatment. And that's coupled with all the herbs and the other stuff that I'm taking that will be also noted. So I have 3 bottles because it's 2 peptides are in one, because I had some left over, and then one of the other. And I don't know if I'm going to go into specifics of what they are right now, just because that'll be in another time. But it's peptide therapy, and it's let's just put it this way: and we're working with inflammation overall. We're working with general improvements that are going to help any of the conditions I have, let alone instead of, I should say, looking for something that's specifically going to contribute just to one singular name of a condition I have, because we get lost in sort of those specifics, and sometimes, and generally, we're just trying to improve our overall constitution or our health. And that's what they're trying to work with me here at the moment until we determine a different strategy. All right, and still getting over the cold a little bit. I really feel much better, but I'm not back to my full voice. I'm not back to, I still have a little sinus, but very, very minute. It's more in the auditory sound of it than it is in how it impacts me. Okay, so I'm not going to show the injection. This is just a little bit on how you do this from a car and how it can be done. You still have to be very mindful and careful so that you don't want an infection when you're living in a place. You don't want an infection anytime, but especially we can't afford any setbacks and anything else on our plate medically in addition to what we're already going through. And that's a lot about why those who who are in your family or friends, and I still to this day have people that have witnessed me going through this 15 years that don't get it. And they're never gonna get it. Like that song. Never gonna get it, never gonna get it. I'm not gonna go through it, but you know what I'm talking about. There'll be a singing portion of my playlist at another time. And if you don't know that reference, you're young. So, congratulations to you. But if people aren't gonna get it, stop wasting your time and energy, regardless of if they're family, friends, strangers. Do it for yourself, advocate for yourself, be careful, be aware, and be confident in that, and try to let it go as much as possible. I'm guilty of myself of fighting those battles, and it's a waste of time and energy. And truthfully, just let them go if you can. So that's something I have to give myself the same advice. So don't think I'm ever espousing any sort of advice that I don't try to take myself and that I don't fail at often. All right? Thanks for listening. Please please subscribe, please dislike if you don't like it. I hope you don't, but just ignore it then. But comment. It's really nice. I've had very few comments, but the ones that... All right, we'll see if I was able to edit that back together. I have to learn to put on airplane mode when I do videos, because just towards the tail end there it got interrupted. And I'm not exactly sure where I left off. But since the break, or whatever, I actually did the injection. And I'm getting better at it, I can tell. I may even be getting a slightly bit more belly fat, I hope, to kind of put it in there, the injection. And so, yeah, and I'm getting better, improving in drawing back the fluid. And I'll show you, because now I have to add 1 peptide to a certain point in the syringe, and then put the needle into the other bottle and pull back 10 cc's of another. And if I don't do that really slow and I get too many bubbles in there, it's not going into a vein or anything, so you're not going to kill yourself by injecting a air bubble, but you still don't want to put that in there. And so you really want to be as careful and take your time. It's frustrating sometimes because you're just like, it's a little thing to pull back, but you stack them onto each other, and then boom, into your belly. And again, I'll say that needle gets dulled, and it's like, ugh, gotta shove it in there. If I'm making any of you guys queasy, I'm sorry. But that's just part of it. And yeah, I always feel excited about the possibilities afterwards once I've done an injection, whether it's swallowing a pill as well, whether it's any sort of treatment that I believe in and has the opportunity to work for me, and I've actually felt some of the benefits. It really, I know it enhances the effects, but I get excited about it. And so now it's done, boom, can get on my day. I go put this back in the cooler and talk about other things eventually in here. But I mean, just something I happen to have in my pocket now that I used to carry around. I think I've mentioned it before, but you really, our safety when we're living, just living in general, but safety when you're living more on the streets or homeless, you're going to encounter more people who might not be thinking as clearly as you might be, or they might be on their last F to give that day, and maybe they just not anything you had done to them, but they can lash out at you. You have to be careful. There is violence that happens out here, and just avoiding it is the best thing. But I do carry around a spray that I've ordered on Amazon. I had another one before, and fortunately I pulled it out but never had to fully use it. But it's a pepper spray, and I think it's really effective if you like to walk and be out with dogs or run. Dogs, especially certain breeds, can really put the fear of God in you, and can cause a lot of damage, and you might even be able to protect somebody else, and it's not going to harm the dog permanently or anything, but it might be a deterrent to allow you to get away, get in your car, whatever. So I think this is a great thing also for human type of offenders. So just something I thought about today to add to this, and maybe we'll be in a later series of just general safety and how to avoid a percentage of what you can encounter to endanger you in life. But you're never going to be able to avoid it all unless you just stay in a bubble room, but then you're going to be harming yourself otherwise. So you can reduce these factors, I believe, to a large extent just by body language and some of the mindfulness techniques that can work in other parts of your life that will keep you safe. And this is not coming from a person who hasn't walked that walk. Without going into much depth, I will say that I have traveled solo since pretty young age, and I have had the street savvy that I've incorporated up until my 40s, and I've used them in countries and environments and cities that are known to be extremely dangerous. And I'll name one as an example, a country I love. Well, two. Mexico's near and dear to my heart, one of my favorite countries, if not my favorite. Sorry about that. But I've lived there, and there's certain protocol and certain rules I follow to stay safe. And then I'll add Brazil to that list, which love the people, love the country. And they'll say themselves that you have to take care. And it is you can just look up Brazil and the dangers. And so I've utilized a lot of these practices, and some of it might be chance. We can't attribute, just like regular treatments, we can't attribute saying they'll work across the board. But I do believe it has reduced some of the incidents and the potential thefts, even if I'm not in the car, the theft to my car, namely right here, a cheap impediment you can get, a club. I have two. I have one for the brake, and I have one for my wheel. It takes a few minutes, but when I'm in a more, risky area, but even not, I a lot of times just put it on as a deterrent. And I don't always even lock it. Most of the time I do, but some things are just very subtle deterrents that go a long way and impact your life very little. So I think that includes hand washing. That includes putting on a mask if you're sick. That includes putting on your seatbelt when you drive, not using your phone and being distracted with using hands-free devices, not drinking and driving. A lot of things, driving at certain times of the day instead of others, because our vehicles, and when we're in them, are probably some of the most dangerous things we can be doing, whether you're chronically ill or not. Going forward with that, if you are chronically ill, we all know that going to a hospital even if you're getting care, if you don't have to, avoid it because difficult. Going to a young children's area because they're lovely, kids are great, but they are pretty good at passing along their germs and they're not quite aware of covering their mouths or not touching things or whatever. So something to keep in mind, and to not come off as, sometimes people who have chronic illness stuff come off as people who don't like children, or they come off as fearful of a lot of things, but there's a real fine line, and I think everybody has to respect, or should respect, whether they have to or not. It would be great if they did, everybody's individual risk assessment, and that's something I was talking about in the previous video that I hope I'll be able to tie these together seamlessly. We'll see. All right, I'm gonna go do a little bit of yoga, my first full Kundalini yoga set that I've done since I was knocked back by the virus. Thank you again for following along. I hope you find this interesting at some levels, and some of these messages cross over platforms between, or audiences I should say, not only those who are going through chronic illness, not only those who have chronic illness and are on the road, those who just want to travel, if you just want to live out of your car, if you want to reduce your cost, if you want to remain safe, if you want to save money on your lifestyle so that you can have more for your children or more for some of your goals. That's some of the stuff that I hope to speak to more as time goes on. Thanks again. Take care. Like, subscribe. I gotta keep saying that. You can tell I'm not a big fan of self-promotion. I'm trying. Bear with me. If I become obnoxious later on, I maybe already am, well, that's how you just ignore me.